God have made all things, and God gives wisdom. It is even the same God who says, he who lacks knowledge should ask him.
All IVF and related techniques are associated with oocyte retrieval from the human ovary and the preparation of spermatozoa for in vitro fertilization. An IVF treatment comprises of several closely related but separated entities such as ovarian hyperstimulation, ovulation induction and timing, oocyte retrieval, gamete embryo culture, embryo transfer, luteal phase support, pregnancy test, and confirmation of pregnancy.
Intrauterine insemination is the simplest and the most basic form of assisted reproduction, and this is indicated mainly for people who have what we call unexplained infertility, people who we cannot find. We have done those examinations or tests, and we can't find any reason why they're not having a child. So it's mainly indicated for them, but also there are some other things that we need to look at from our evaluation. It's not probably the first choice of treatment for people above 38 because the success rate will be lower. So, but if a woman is below 38 and we don't find any reason for infertility, intrauterine insemination is one thing to look at. In cases of cervical hostility, where the sperm is just being killed at the level of the cervix, we can use intrauterine insemination, or women who have had surgery on their cervix and is making it to be hostile. There is a particular common surgery that we call cone biopsy of the cervix that changes the milieu of the cervix. That is, the epithelium of the cervix changes, and then that might be hostile to the sperm. So we could use intrauterine insemination for such people. You could also use it in people who are not ovulating. When you have tried to, for instance, you try to induce ovulation and you see that you have induced ovulation and still this patient is not getting pregnant, you could use intrauterine insemination. You could also use it in very mild forms of oligospermia, when the sperm count is not very, very good, but it's not really very bad. Well, we're talking about sperm count, say between less than 20 million and then up to, worst case scenario, up to about 10 million. Anything below 10 million, one must be careful to use intrauterine insemination in this kind of cases. So those are some of the cases where you use intrauterine insemination. Now, when we have done about 3-4 intrauterine inseminations and they are not successful, then we have to proceed to something more complex. That's when IVF now comes in. So the indications for IVF will come from either repeated failure of intrauterine insemination or outright indications for IVF, for instance, when there is tuber blockage, because the fertilization takes place in the tubes. So once they are blocked, then you need to make fertilization take place outside the body. Then we use it also for endometriosis. We use it in endometriosis. We also use it in, just like we said, unexplained infertility. And some also mild sperm problems you can use in vitro fertilization. But for really bad sperm problems, then you cannot use IVF. What we'll be using in that point in time will be ICSI, or intracytoplasmic sperm injection. So the main indication for ICSI is low sperm count or bad sperm parameters. And that's ICSI. It involves that we take one sperm cell and inject it into one egg, which we say is micromanipulating the eggs.
In order to prepare a proper environment in the woman and to increase the chances of recovering several healthy and mature eggs, the woman will undergo about 2 weeks of intensive preparation. This will include hormonal therapy with fertility drugs. Blood tests and ultrasound scans of the ovaries are used to determine the optimal time to retrieve the eggs from the ovary. At the appropriate time, an outpatient procedure under local anesthesia will enable the female's egg to be visualized by ultrasound and retrieved from the ovary by placing a needle through the vaginal wall. The patient may feel a mild discomfort, and after a short rest, the patient will be able to go home and resume normal activities.
The first stage is the bringing out of the eggs from the woman. We bring out the eggs from the woman, after which we store them in the incubator. Then, depending on the treatment option we offer them, we can do ICSI on them or just straight IVF. Then after, we culture the embryos for at least 2 to 3 days before we now put back into the woman. After 16 days, we do the pregnancy test.
Crop preservation unit, in a layman language, is just a process of keeping human material under low temperature, and this offers the client the opportunity of having to revisit their treatment cycle should they have excess embryo, and from the 2-3 years, whether the first one succeeds or not, they might still come back and visit the stored embryo, which will still give them hope of parenthood.
At Nordica, patients are treated as partners in the fertility treatment and work with them to determine the treatment option that will be most appropriate for their situation based on financial, social, religious, ethical, and medical factors.
We don't see them as patients. We even actually refer to them as clients, because in partnership we will be able to achieve what they have come for. We don't see this as a physical ailment. It's not really physical, it is really emotional. So we have to see them as friends, as partners, and encourage them that they have to be in partnership with us to ensure the success of the procedure.
We have a good rapport so that will make them come back in few times to come or in few months to come. Then with that, we're trying to introduce them to what we are really doing here, that is the processing of the treatments.
They asked me to pray. They asked me to pray about it. So having known that there are other things, when you talk about maybe low sperm count, these people, they are able to extract no matter little that count is.
We place a high premium on children, and if anything can make people not go to the wrong places, for instance, where people do a lot of things in order to just have their own children, things that you can't even mention, you don't want to even mention. And if it's possible now, because what we try to make people see is that infertility is like any medical disease. People need to know that infertility is a medical condition and which can be treated medically.
The journey of 1,000 years begins with a step, and by taking that first step to arrest the torture of infertility, the option of assisted conception may just be the link to achieve a dream that only destiny holds.